Good morning, everyone. Today I am here to present my seminar on the topic of neuroimaging and neuroanatomical circuits in anxiety with fear. And my moderator is Dr. Shobit Garg, sir. Anxiety is an emotional state which is subjectively experienced as unpleasant or threatening. Symptoms of anxiety include changes in mood like apprehension and fear, and cognitions like thoughts of impending mishap, and is generally accompanied by physiological and behavioral changes such as palpitation, sweating, and hypervigilance. Unlike other psychiatric disorders, anxiety is a normal emotion serving as a useful arousal response to threatening or stressful stimuli, but it becomes pathological when the response to the perceived stimuli becomes over-exaggerated, irrational, and disruptive, and hence interferes with the person's ability to function normally. A distinction can be made between the state and trait anxiety. State anxiety is often associated with a particular stressful event and remits once the stimulus is removed. On the other hand, trait anxiety is a persistent feature of an individual's personality. Amygdala is an almond-shaped brain center located near the hippocampus and has important anatomical connections which allow it to integrate sensory and cognitive information and determine whether there will be a fear response or not. Processing of the fear is regulated by numerous neuronal connections following into and out of the amygdala. This is a diagram depicting that amygdala forms reciprocal connections with orbitofrontal cortex and anterior cingulate cortex and regulates the feeling of fear. Fear response can also include motor responses like fight, flight, or freeze. This motor response of fear is regulated by connections between amygdala and periaqueductal gray area of the brainstem. There are some endocrine reactions that accompany fear due to connections between amygdala and hypothalamus, causing changes in the hypothalamus pituitary adrenal axis. There are some endocrine reactions that accompany fear due to connections between amygdala and hypothalamus, causing changes in the hypothalamo-pituitary adrenal axis and thus of the cortisol levels. A quick boost of cortisol may enhance survival when encountering a real but short-term threat. However, chronic and persistent activation of this neuroanatomical circuit can lead to increased medical comorbidities like coronary artery disease, type 2 diabetes mellitus, stroke, and also hippocampal atrophy. Breathing can also change during a fear response, which is regulated by connections between amygdala and parabrachial nucleus in the brainstem. Increase in respiratory rate is an adaptive response to fear when having a flight or fight reaction to enhance survival. But in excess, this can lead to unwanted symptoms of shortness of breath, exacerbation of asthma, or a false sense of being smothered. All these symptoms are common during anxiety and especially during attacks of anxiety such as panic. Autonomic nervous system is also attuned autonomic nervous system is also attuned to fear and is able to trigger responses from cardiovascular system such as increased heart rate, blood pressure for flight and fight reaction, and survival during real threats. These responses are mediated by connection between locus coeruleus and amygdala. Locus coeruleus contains noradrenergic cell bodies. When autonomic responses are repetitive, inappropriately, or chronically triggered as part of an anxiety disorder, this can lead to increase in atherosclerosis, cardiac ischemia, and MI and sudden death. Hippocampus is the structure in which memories are stored. Anxiety can be triggered internally from traumatic memories stored in the hippocampus and activated by a connection between amygdala, especially in conditions such as post-traumatic stress disorder. This is a diagram depicting that the neuroanatomical circuits we have studied till now are modulated by some neurochemicals, neurotransmitters like serotonin, GABA, glutamate, corticotrophin releasing hormone, norepinephrine, and which leads to fear, panic, and phobia. Threat response system. Acute pain is essential for survival by avoidance of tissue damage and by promotion of healing. This is not so for chronic pain that has no beneficial value. Fear is defined as a fundamental emotion, promptly arising in context of tangible and acute threat, appropriate when reality-based and amenable to cognitive control, but is deemed to be a phobia if it becomes irrational. This is a schematic overview of the neurobiological processes underlying evolution of chronic pain and anxiety disorder. Sensory inputs concerning threats are related to the amygdala and other related limbic structures like central nucleus, nucleus accumbens, basal nucleus for generation of fear or acute pain-related physiological, behavioral, and cognitive processes. Anxiety and chronic pain symptomatology are characterized by engagement of the extended amygdala structure and a large surge of allosteric load, which leads to the cortical disintegration. This is another schematic overview of two system construct underlying the chronic pain and the anxiety disorder. Sensory inputs of nociceptive nature may give rise to pain, while threatening visuals, auditory, gustatory, olfactory, or tactile stimulation can give rise to fear. Pain is conceptualized to be a failure of the limbic system to get components of nociceptive information from reaching the conscious awareness. Chronic pain and anxiety symptoms may be attributed to a disintegration of two system constructs comprised of subcortical circuits mediating the of two system construct comprised of subcortical circuit mediating unconscious threat-related physiological, emotional, and behavioral responses in conjugation with linked yet potentially independent higher corticolimbic network producing cognitive experiences. This is another diagram depicting fear conditioning. When an individual encounters a stressful or fearful condition experience, the sensory input is related to the amygdala, where it is integrated with input from the ventromedial prefrontal cortex and hippocampus, which determine that the threat response will be triggered or whether it will be suppressed. Amygdala may remember stimuli associated with the previous experience by increasing the efficiency of the glutamate neurotransmitter so that on further exposure to stimuli, a fear response is more efficiently triggered. If this is not countered by input from the ventromedial prefrontal cortex to suppress the fear response, fear conditioning proceeds. Fear conditioning is not readily reversed, but it can be initiated through new learning. This new learning is termed as the fear extinction and is progressive reduction of the response to a feared stimulus that is repeatedly present without adverse consequences. Thus, the ventromedial, prefrontal cortex, and hippocampus learn a new context for the feared stimulus and send input to the amygdala to suppress the fear response. The memory of the conditioning fear is still present. Neuroimaging in anxiety disorder. These are a few MRI images depicting the important structures related to anxiety disorder, one of which is the most important, and other one is hippocampus. On structural imaging, that is CT and MRI, it was found that there was occasional increase in the size of the ventricles, abnormalities in the right hemisphere, but not in the left hemisphere. This finding suggests that some type of cerebral asymmetry may be important in the development of the anxiety disorder. On functional imaging like functional MRI, SPECT, PET, abnormalities in the frontal cortex, occipital and temporal areas in patients with anxiety disorders and abnormalities in parahippocampal gyrus in patients with panic disorder was detected. On magnetic resonance spectroscopy, In panic disorder, it was used to record the level of lactate, whose IV infusion can precipitate panic episodes in almost three-fourths of the patients with either panic disorder or major depression. But brain lactate concentration was found to be elevated during the panic attacks, even without provocative infusion in panic disorder patients. Studies in PTSD Vietnam combat veterans revealed that reduced left and right hippocampal volume reduction were associated with severity of combat exposure. A similar study was undertaken with Gulf War Vietnams in Israel. These data have shown similar findings. Smaller hippocampal volume is not a necessary risk factor for developing PTSD and does not occur within 6 months of expressing the disorder. This brain abnormality might occur in individuals with chronic or complicated PTSD. Twin study in PTSD. A study reported in Nature Neuroscience evaluated MR brain morphometry of the hippocampus in monozygotic twins discordant for PTSD. The PTSD twin was diagnosed with PTSD as a result of combat exposure in the Vietnam War. Twin aspect of this study was important as it showed that individual discordant for PTSD showed reduced hippocampal volume compared with twins where PTSD was present in neither of the twins. This finding suggests that there may be a predisposition or vulnerability factor involved in the genesis of the PTSD. Functional imaging in PTSD, functional MRI studies have found increased activity in amygdala, important brain region which is associated with fear. In specific phobias, it was found imaging findings suggest activation of anterior paralimbic regions and sensory association cortices corresponding to sensory modality associated with symptomatic state. On functional MRI data, it suggests that amygdala hyperresponsivity occurs selectively to phobia relevant stimuli and may be related to disrupted interaction with cortical regions that typically play a role in emotion regulation. In social anxiety disorder, functional neuroimaging studies indicated that medial temporal lobe structures showed exaggerated responsivity, especially to social stimuli, and amygdala hyperresponsivity in response to social threat. In generalized anxiety disorder, neuroimaging studies highlighted the role of disrupted functional anterior cingulate cortex and amygdala connection and structural connection with uncinate fasciculus. Findings were consistent with core features of emotion dysregulation, which may be associated with weaker frontoamygdala connectivity and fear overgeneralization, which appears to relate to alteration in the ventromedial prefrontal cortex and its connection. These are my references. When an individual encounters a stressful stimuli or a threatful condition or experience, the sensory input is relayed to the amygdala, where it is integrated with input from the ventromedial where it is integrated with input from the ventromedial prefrontal cortex and the hippocampus. And these decide that whether the fear response will be generated or it will be suppressed. Amygdala remembers stimuli associated with the past experience by increasing the efficiency of the glutamate neurotransmission so that on future exposure to stimuli and glutamate. So that on future exposure to stimuli, a fear response is more efficiently triggered. Amygdala take the help of glutamate for a future response, which will be more efficient than the past response. If this is not encountered by input from ventromedial prefrontal cortex to suppress the fear response, fear conditioning proceed. Fear conditioning is not readily reversed, but it can be learned. उसको हम reverse नहीं कर सकते, but learn कर सकते हैं बार बार उसी situation को face कर करके. तो जो ये न्यू लर्निंग हम करते हैं बार बार, उससे हमारा फियर एक्सटिंक्शन हो जाता है. ये प्रोसेस रिवर्स नहीं हो पाता, लेकिन इतनी ज्यादा कंडीशनिंग हो जाती है उस एक्सपीरियंस को, तो ग्लूटामेट और एफिशिएंट फियर रिस्पॉन्स प्रोड्यूस करता है, फिर वो एक फियर एक्सटिंक्ट ही होता है, बट वो मेमोरी में रहता है फिर. हाँ जी मैम. मैम वहाँ पे जो स्टडीज अभी तक हुई है, जो ट्विन स्टडीज है, तो उसमें देखा गया कि वो कैंपस में वॉल्यूम रिडक्शन होता है, और मैम फिर वो कैंपस इसमें फियर कंडीशनिंग के लिए रिस्पॉन्सिबल, तो वही वही डिसाइड करें. नहीं मैम, पीटीएसडी के पेशेंट में इमेजिंग में वो कैंपस वॉल्यूम रिडक्शन होता है, बट लेकिन मेन तो स्ट्रेस ही रहेगा कि जो ड्रेडफुल सिचुएशन थी उसकी वजह से. फिर उन पेशेंट्स में जब इमेजिंग की तो उसमें देखा गया कि यस. हाँ जी. यस.
जो लॉन्ग टर्म सीखने फर्स्ट के साथ तो उसमें डिप्रेशन होता है. इट इज सेड टू पीटीएसडी इन्वॉल्वमेंट है इन द सेंस दैट फियर एक्सटिंक्शन को प्रमोट करता है. अपार्ट फ्रॉम दैट ketamine also when like you say like
हाँ भाई, वो साइनेप्टिकली रिलेट करते हैं. लोना
there's a theory that how anxiety is to there is a theory that very ABC how do you use the alarm the ABC alarm when is specific example and
उसमें बुक में नहीं लिखा था कि